Hello everyone, this is Scott from Strive Labs coming to you with today's Tuesday tip. Now, in our last series of Tuesday tips, we discussed the Net Promoter Score and how the Net Promoter Score can be used to improve a number of aspects of your clinical practice. Well, for this series of tips, we're going to be talking about some of those same concepts, except zooming out a little bit, thinking more globally. Today, we're going to be talking about some of the basics of patient retention and what you can do. Now, if you remember back in Tuesday tip number 2, we discussed how you can use Net Promoter for patient retention, how you can kind of identify those patients at risk of dropping out. Well, today we're going to focus on the flip side. We're going to look a little bit more optimistically and show what you can do to keep those people from even happening in the first place. All right, so let's dive on into it. Now, what I've got up in front of us here is a thing we like to use at Strive Hub a lot. It's the patient relationship management process, and I think this is really important for understanding retention. Essentially, what you're trying to do for every patient that comes in your door is convert them, get them from becoming a new referral to a current patient, then retain that patient, and ultimately transition them into a patient evangelist, someone who can continue to spread the good word of your clinic all throughout their friends and family networks. But for the purposes of today, let's focus on this first piece, right? How can you improve that initial experience ultimately to lead to that retained patient? And fortunately, there's a lot of great stuff within Strive Hub that you can use to make that happen. Today, we're going to focus on the very, very beginning of it, right? That patient's first experience. Now, the first experience is critical, especially if this is someone who's never come into physical therapy before or has never come into your physical therapy clinic before, right? Helping them understand what they're going to be getting out of physical therapy can be a really important first step. What we know is that a patient's mental model, meaning how they think about care that you're going to be providing, is critical. It's actually one of the #1 predictors of whether or not a patient is even going to have a good outcome, is whether or not they believe that what you do as a physical therapist is actually going to improve their particular condition, right? So you can actually get off to a great first start with a lot of things that Strive Hub allows you to do. So basically, let me show you how that might work. So one of the fundamental principles of Strive Hub is understanding how to get the right message to the right patient at the right time. Okay, well, for finding the right patient, the first step is we need to create more intelligent lists. Now, lists are nothing more than groups of patients, right? They're segmentation. It's segmentation that allows you to break down your global patient list into smaller buckets. So essentially what's happening is behind the scenes, your EMR is integrating with Strive Hub. So all that patient demographics data, all that scheduling data is getting pulled in and stored within Strive Hub, okay? So it makes it really simple. All you have to do is go and create a list. So I've started to create one already. It's called older low back patients, and you can see it was as simple as just selecting some attributes, right? We wanted body part to equal lumbar low back, and we wanted the age to be above 60. Now, if we wanted to dial that down a little bit more and say we wanted to just focus on a particular primary therapist that was equal to Ryan, right? We could do that with just a couple clicks. Maybe Ryan does something slightly different than everyone else at your practice, and so you want to tailor that message just to him. If we wanted to focus even more and say, well, we're noticing that our Medicare patients are having trouble, right? So we could do, primary insurance, and then we could go ahead and find, a particular one. So let's say, for whatever reason we wanted that. It becomes very simple to slice and dice your patient population with just a couple of clicks. And again, the permutations, the number of different options you can use are very, very simple. So for right now, though, let's keep this one a little bit more broad. We'll just do body part, lumbar, low back, and we'll do age is greater than 60, okay? So go ahead and create that list. I actually already created this list. And because this is a sample environment, we'll just pull in one patient here. All right, so we see that patient meets the list criteria. They're in that list. Now that's great. Now the nice thing is, every time more patients get added to your clinic, meaning every time somebody comes in the door, that patient gets synced with Strive Hub. Automatically, we're going to determine what lists they should go into based on the criteria you set. So you never have to recreate that list. Once you create that bucket, patients who fit that bucket will fall into it. If all of a sudden something changes and they no longer fit in that bucket anymore, they'll get pulled out of it. So it makes it very easy for you, the clinic owner. All right, so that's how you get the right patient. Now, if we want to keep using this example, let's think about sending them something valuable, right? So in this case, let's say that this was a low back pain patient. We wanted to help them understand what physical therapy was going to do for the treatment of their low back pain. Well, one thing that a lot of our customers have been doing is essentially creating an email similar to this, right? Your back pain explained. And really what it allows you to do is customize it, personalize it towards that patient, and then give them more and more information about how you're going to go about treating them. What this does is it allows you to start start framing that mental model early. Even before they've even stepped inside your clinic, they're starting to understand what physical therapy does. Now, this is hugely important. As Donald would say, it is huge, right, for you to be able to get this. To your patients ahead of time. So this is really important. We want you to focus in on this. And this is just a single example. Now, how do you make sure it gets out at the right time? Well, this is where also Strive Hub really shines. It becomes nice and easy to use, okay? We've got the right message. Now let's set the right triggers. So I've already gone ahead and created a workflow here. It's called low back pain IE. And now let's go ahead and edit this, and I'll show you what it looks like. Basically, we're just selecting that list we created before, right? That low back pain patients. We're selecting that piece of content, that email that just got created, that low back pain IE information. And then it's really simple. Let's just set a trigger, right? 2 days before initial evaluation. Okay, it's as simple as that. If we wanted to change that trigger, we wanted to send it a couple days after, we could, but in this case, we want to send it before. If we were doing other types of workflows where we wanted to focus it around other important times in care, you could do that, right? Their case creation date, when they actually get added to the system, their date of their last visit or their date of discharge, all these things can be triggered around so that you're making sure that the right message is being sent at the right time. And it's as simple as that. Once we basically hit update workflow, this is going to every day scan through, find patients in that list who fit that right point in care. In this case, 2 days before initial evaluation. So that's great. And the example is really simple. If I come on over here to my email, I will show you. Basically, the patient's just going to get that. It's going to be branded towards your clinic. It's going to have that information already loaded in there. If you want to link them to some other aspects, like some important things that they might need to know, we can go ahead and load that right up, right? So it becomes very simple for you to automate getting this right information out to those right patients. The beauty of it is you're never sending irrelevant information. You're always sending it just to the patients who need it. This is incredibly valuable in framing that mental model, making sure that the patient understands how physical therapy is going to help them improve. So as always, this has been just a quick tip on how you can start thinking about patient retention in your physical therapy practice. While we love to show you how Strive Hub works, remember that all of these things can be done on a smaller scale, right? This is just email. Okay, there's no reason you can't be keeping track of who these patients are, having these standardized emails, sending them out to patients around those points in care. Hopefully Strive Hub just makes it a little simpler, makes it a little less labor intensive for you. But if you guys have any questions on this or other similar topics, feel free to reach out to us. You can email me directly at scott@strivelabs.com. You can hit us up at Twitter at strive_labs, or you could also just email us globally, hello@strivelabs.com. All right, guys. Well, as always, it's been great talking to you. Hopefully this gave you a good idea as to how to start working on patient retention when patients first come in the door. Take care. Bye.